Be intact with no obvious lesions. They are aligned according directly from her eyebrows, and they appear to be the same color as her skin. There's no lumps or deformities. She does have a piercing in each ear, and they're aligned with the tops of her eyebrows. I'm going to touch your ears, and you let me know if you feel any pain or tenderness. Is there any pain or tenderness when I touch your ears, Lindsay?
No.
Okay, thank you. Any pain or tenderness?
No.
All right, thank you. I'm going to take a look inside of your ears, Lindsay. Okay. Insides of Lindsay's ears, her tympanic membrane is pearly gray. I'm going to take a look in this ear. And I can see the cone of light at 7 o'clock, and I saw it at 5 o'clock in the other ear. And her bony landmarks were present in both ears. Okay, Lindsay, I'm going to test your hearing, so I want you to close that one ear. I'll whisper 3 words, and I want you to repeat those words to me. Okay?
Okay.
Close that ear for me.
Monday. Baseball. Football.
All right, and I'll look to the other ear. Can you close that one for me?
Tuesday. Armchair. Baseball.
Thank you. All right. Okay, Lindsay, I'm going to strike this tuning fork. I'm going to place it behind your ear. When you hear that sound stop, I want you to let me know, and I'll place it next to your ear, right outside of your ear, and then you let me know when that sound stops as well, okay?
Okay. No. No.
Okay, thank you, and I'll do the other side.
No. No.
Air conduction was twice as long as bone conduction. All right, now I'm going to strike the tuning fork, and I'm going to place it on the middle of your head, and you let me know where you hear the sound the most, okay?
Same.
Okay, Lindsay hears the sound equally in both ears. Cranial nerve 8 is intact. Okay. Lindsay's nose is symmetrical, and it is proportionate to her face. It's midline, and it's, like I said, it's proportional to her other facial features, and the skin on her nose is intact without any lesions or deformities. Okay? Lindsay, I want you to close one side of your nose and snip, and now I want you to switch sides. Okay? There doesn't appear to be any obstructions, and her nares sound clear. Okay, Lindsay, now I'm going to inspect the inside of your nose. And I'm just going to lift up the tip of your nose. Look inside. Okay. Lindsay's nasal mucosa is pink and moist, and her turbinates are intact. And there's a firm consistency. Her septum is midline, and there appears to be a smooth surface. Okay, Lindsay, I'm going to ask you to close your eyes and I want you to hold one side of your nose. I'm going to put some scents under there and I want you to let me know what that smell is. So can you close your eyes and hold one side?
Coffee.
Okay. And keep your eyes closed.
Oh, sorry.
You can close one side of your nose, please.
Lemon.
Cranial nerve number 1 is intact. Lindsay was able to differentiate between the 2 different smells. Lindsay, I'm going to ask that you open your mouth. Okay. Lindsay's tongue is smooth and there doesn't appear to be any lesions. Her mucosa is moist and pink. Raise your tongue for me, please. And the ventral side of her tongue, there's veins and it's glistening. Her teeth appear to be in good repair. I'm just going to push. Stop it. There's no lesions. Teeth adhere very nicely. Okay. Her palates are intact. And her tonsils are about a +1. Okay. Can you stick out your tongue for me, please? Her tongue is symmetrical. Cranial nerve number 12 is intact. And can you open your mouth and say please? Okay, her uvula rises midline and upward, and so cranial nerves 9 and 10 are intact. Okay. All right, Lindsay's head is midline and her muscles appear to be symmetrical with no lumps or masses or pulsations. I'm going to assess your lymph nodes right now. And you let me know if you ever feel any pain or tenderness.
No.
No pain or tenderness? Can you hunch your shoulders forward a little bit? Hunch your shoulders forward. And then you to the side. And then to the other side. Okay. All right. I cannot palpate any of Lindsay's lymph nodes. All right, Lindsay. Now I'm going to feel for your carotid pulse. So I want you to lean your head towards the side. And on the other side. Lindsay's pulse is about a +2. All right. Okay, Lindsay, I want you to shrug your shoulders for me. Okay? Now I want you to do it against my hands. Very nice. Okay. Now I want you to turn your head to the left and now to the right. And I want you to turn it to the left again. Against my hand. And then to the right against my hand. Okay. Okay. Cranial nerves number 11 is intact. Lindsay has full range of motion against gravity and resistance. I'm going to ask that you swing your feet around this way. Okay, I'm going to take a look and move here a little bit. Lindsay's anterior posterior to transverse, the diameter is 2 to 1. Her thoracic cage is symmetric and has an elliptical shape with downward sloping ribs, and her skin appears to be intact with no lesions. Okay. Now, Lindsay, I'm going to ask that you take a deep breath. Okay. Lindsay has chest expansion that's symmetrical with no lag and expansion. Then we're gonna palpate C7, T1, or scapulae. Do you have any pain or tenderness when I do that?
No.
Okay. And now I'm gonna palpate Lindsay's spine. Do you feel any pain or tenderness as my hands are moving all the way down your spine?
No, I don't.
Okay. I'm gonna ask that you hunch your shoulders over. Very good. Okay, we heard resonance in all of the fields. Now can you put your hands across your lap for me, please? And I want you to breathe through your mouth, usually a little bit deeper than you normally breathe, okay, while I listen to your breath sounds, okay?
Okay.
I'm gonna ask that you raise your arm. And then we'll listen on the side. Okay, thank you. Deep breath. On the side. All right, Lindsay's breath sounds are clear and equal. All right, can you swing the lights back around? I'm gonna pull your gown down. Okay, Lindsay's respirations are even. Her skin is intact on her anterior chest, her costal margin is less than 90 degrees. Identify the angle of buoy in her sternum. Okay. And her second rib and her second intercostal space. Okay, and now I'm going to listen for breath sounds, so